I'm actually from Milverton. I was a receiver. My main job was unloading like these big boxes of toilets, and that's doing that over and over every week. That's what I can't do any lifting with my injury to my left arm.
Our chronic disease nurse called this patient for a routine diabetic check. And as part of that routine chronic disease management check, it was determined that he did not have food security, that he was struggling to pay his bills, that his mood was decreasing, and we know that that directly impacts chronic disease management.
I was depressed, big time, really bad, because I didn't know what I was going to do next. I had no money or whatever, and I was getting behind in all my bills, so they really helped me. The team here really helped me.
In the past, home care has been very siloed, and so there's always been one person doing this and one person doing that.
So they might have a nurse from one organization, a PSW from another, and a physio from a third organization. All those organizations work independently. They don't share information. In the new integrated patient care team, there's one care provider that works for the family health team. They work closely with the care coordinator, they work closely with the family physician or nurse practitioner, and all of the care is coordinated together.
Sort of the old model maybe was looking more at there's this one issue, and so we'll deal with this one issue, and not looking at the greater picture, not looking at the whole person. So if it's patient-centered care, we really need to listen to the patients.
They helped me out a lot, try and get in touch with different agencies. Unemployment, WSIB, and long-term disability. Got on the phone and helped me out a lot. Nurse practitioner, outreach, social worker, and my physiotherapist here.
So for the patients and their families, the benefits of this program is that they get to receive the home care services in their home environment. We meet them at where they're at and actually get to go into the home environment, see how they're managing at home, and then working with them and collaborating to meet their goals, letting them have a say in how they want their care to be performed.
The other piece with this model, with the integrated patient care team, is that the patient always has a go-to person, and that person will answer the questions and integrate with the team or coordinate with the team to support the patient, versus having to call 6 different organizations to get their questions answered.
From a team approach, yes. I find it very helpful to know what the PSW is working on, the OT, and that type of thing. It's more of a collaborative approach in terms of the team, and I think that in the grand scheme of things, it's more supportive for that individual, because then we know what's kind of going on, and we don't need to ask those same repetitive questions and kind of bog them down with the same thing over and over and over again.
As we know, social determinants of health impact health outcomes. Mental health, financial, socioeconomic, housing, food insecurity, all these things are so important. And when you can marry social determinants of health with clinical expertise, you create equitable care for our patients and our community members.
One of the big benefits that I've seen in this program is the fact that we're really breaking down some of the digital interoperability. We have organizations that typically practice in different electronic medical records, and when we all come together and we're able to use technology like hypercare, we can all communicate in real time.
Usually we share what we saw during our visit that week. Sometimes it's not something that will impact in my role, but it will impact in the social worker role or in the nurse. And once a week, we do have a meeting specifically to that patient, and everybody log in and we can discuss and we can change informations, we can share ideas. So this make our life much easier and impact on the patient's health for sure.
The feedback that we've received so far from a lot of our clients and families has been very positive. They've really appreciated our ability to communicate with them and our ability to provide the services to them in the home. We really want to get somebody back to being as independent as possible and getting them back to that place where they feel comfortable and able to support themselves in the community.
Actually, the patient feel like we are one team taking care of him.
When I followed up with the patient and I said, how's it going? His reply was, he's been able to back pay on his rent. He's been able to get linked into the proper specialist. He's been able to make the follow-up appointments.
Well, it's nice having everybody in the same building here. I'm a shy person, like I'd rather come here to do it.
There's a lot of individuals who are struggling around the systematic barriers, and being able to provide that support is something that's important, and that home care approach that is more flexible and able to kind of have that collaboration provides that support. I'm excited about it personally because in my specific role, it gives me more flexibility and more time to be able to help that person in more of a wholesome approach, to build rapport, build that trust, be able to enhance their quality of life in a more relaxed manner.
I do believe that these new Ontario Health Teams, this IPTC program, is going to be the future of home care and be able to ensure that clients are getting the care and support that they need versus them falling through the cracks.